Hi everyone. We are the Group 10, Imogene King, Goal of Attainment Theory. Presented by Jester, Risalin, Leilani, Navdeep, Janet, and Nidhi. Dr. Imogene Martina King. Born January 30, 1923 in West Point, Iowa and died December 24, 2007 in St. Petersburg, Florida. Received her diploma in nursing in 1945 from St. John's Hospital School of Nursing in St. Louis, Missouri. She received her BScN in 1948 and MScN in 1957 from the St. Louis University, Missouri, also received her doctorate in education in 1961 from Columbia University, New York. Theory of goal attainment. This theory was developed by King in 1981, based on her work on nursing concepts and conceptual systems of the 1960s. The theory describes the nature of nurse-client interactions that lead to achievement of goals. Major concepts of the theory. King described three dynamic interacting systems. These three types of systems represent organized wholes in constant interaction in one's environment. And human beings are the basic element in each system. These systems are: 1. Personal system. 2. Interpersonal system. 3. Social system. Personal system. The personal system is represented by each individual person. For example, nurse, or patient. In the personal system, the human being or person is understood by concepts of perception, self, growth and development, body image, and of space and time. Definitions used by King are as follows. Perception, each person's representation of reality. Self, a composite of thoughts and feelings which constitute a person's awareness of his individual existence, his conception of who and what he is. Growth and development, the continuous changes in individuals at the cellular, molecular, and behavioral levels of activities, also the processes that take place in the life of individuals that help them move from potential capacity for achievement to self-actualization. Body image, the way one perceives both one's body and others' reactions to one's appearance. Space, space exists in all directions, is the same everywhere, and is defined by the physical area known as territory and by the behaviors of those occupying it. Time, a duration between one event and another as uniquely experienced by each human being, it is the relation of one event to another event. Interpersonal systems. The interpersonal systems are formed by human beings interacting. For example, nurse-client relationship occurs when two or three or a small group such as a family interact. As the number interacting increases, so does the complexity of the interactions. Understanding interpersonal systems requires the concepts of interaction, communication, transaction, role and stress. Interaction, the observable behaviors of two or more individuals in mutual presence. Communication, a process whereby information is given from one person to another either directly in a face-to-face meeting or indirectly through telephone, television, or written word. Transaction, a process of interactions in which human beings communicate with the environment to achieve goals that are valued and goal-directed human behaviors. Role, a set of behaviors expected of persons occupying a position in a social system, rules that define rights and obligations in a position, a relationship with one or more individuals interacting in specific situations for a purpose. Stress, a dynamic state whereby a human being interacts with the environment to maintain balance for growth, development, and performance, which involves an exchange of energy and information between the person and the environment for regulation and control of the stressors. Social system. The social system is a more comprehensive interacting system consisting of the larger groups in society. Examples of social systems include the healthcare system, the education system, and the influence of extended family on an individual. The concepts of organization, authority, power, status and decision-making affect the understanding of the social system. Organization is composed of human beings with prescribed roles and positions who use resources to accomplish personal and organizational goals. Authority a transactional process characterized by active, reciprocal relations in which members' values, backgrounds, and perceptions play a role in defining, validating, and accepting the authority of individuals within an organization. Power, the capacity and ability to use and mobilize resources to achieve goals exerting influence. Status, the position of an individual in a group or a group in relation to other groups in an organization, accompanied by privileges, duties and obligation. Decision-making, a dynamic and systematic process by which goal-directed choice of perceived alternatives is made and acted upon by individuals or groups to answer a question and attain a goal. King's theory was based on an overall assumption that the focus of nursing is human beings, interacting with their environment, leading to a state of health for individuals, which is the ability to function in social roles. The assumptions are: 1. The focus of nursing is the care of the human being, patient. 2. The goal of nursing is the health care of both individuals and groups. 3. Human beings are open systems interacting with their environments constantly. 4. The nurse and patient communicate information, set goals mutually, and then act to achieve these goals. This is the basic assumption to the nursing process. 5. Patients perceive the world as a complete person making transactions with individuals and the environment. 6. Transaction represents a life situation in which the perceiver and the thing being perceived are encountered. It also represents a life situation in which the person enters the situation as an active participant. Each is changed in the process of these experiences. In the high-tech world of the 21st century, systems have been designed to provide access to data, information, and knowledge for nurses to use. Nursing informatics has provided the framework that is a combination of computer science, information science, and nursing science designed to assist in the management and processing of nursing data, information, and knowledge to support the practice of nursing and delivery of nursing care. The diverse phenomena that nurses encounter in the complex world of nursing has led to the development of classification systems, conceptual systems, and theories. One approach in the organization and management of such systems has revolved around structure, process, and outcome. An example that provides structure, process, and outcome in nursing and healthcare systems is King's conceptual system, theory of goal attainment, and transaction process model. King's law of human interaction states that two or more human beings in mutual presence, face-to-face or via technology, interacting purposefully, making transactions in real-world nursing situations that led to goal attainment, which represent outcomes. Outcomes provide evidence-based nursing practice. Mr. B, a 71-year African-American male, admitted to the unit for acute appendicitis and pending for emergency surgery. He also has history of diabetes mellitus and hypertension for 20 years. Currently, he is on regular insulin and his blood sugar is under control. He is accompanied with his wife, Mrs. B, of 35 years. Both appear anxious and worried. They have 3 older children who are all married and live within the city limits. They are not present but are aware of the situation. He is sweating and writhing on the gurney and cries out when moved to the hospital bed. Assessment. Main complaint: acute abdominal discomfort, sudden onset tender to palpation. Physical assessment. BP 160/100, heart rate 88, respiratory rate 24, blood sugar 9.0, pain scale 9 out of 10.
This is really painful. Is there anything I can get for that?
I can give you some painkillers. Past medical history. Diabetes type 2 for 20 years. Hypertension for 10 years. Cataract surgery 5 years ago. Medications. Regular insulin, sliding scale, blood sugar is generally under control. Telmisartan by mouth, once daily, for hypertension. During assessment, nurse collected data and found the patient is worried about outcome of surgery and wound healing.
How will be my wound healing because I am diabetic and old too? Moreover, I have hypertension from 10 years and underwent cataract surgery 5 years ago.
According to Imogene King, Assessment occurs during interaction. After talking to patient, nurse come to know client's perception about his concerns and started to work together to develop nursing diagnosis to deal with patient's anxiety related to surgical procedure and wound healing. He is also concerned about pain after surgery. 1. Anxiety related to surgical procedure. 2. Pain related to acute abdominal discomfort. 3. Deficient knowledge related to surgery, wound treatment and home care. 4. Increased risk of infection and decreased skin integrity related to underlying diabetes. 5. Risk of infection related to possible rupture of appendix.